Good afternoon and welcome to another installment of Voces del ALBA. We are here this evening we have three panelists currently, and hopefully shortly we'll be joined by another. Representing Trinidad and Tobago, we have Angelo Hart from the Movement for Social Justice. We have Gabrielle from Jamaica Lands, and we also have Halim Khan from the president of the Guyana Cuba Solidarity Movement. Good afternoon to all of you, and how are you this evening?
Good afternoon. Thank
Afternoon.
Afternoon.
Good afternoon to all of you, and now we're going to be discussing the reality of COVID on democracy and governance. And I think everyone here is aware of the really serious impact that we have had in these past few months, and we've seen how the governance structure could have impacted how it would have been regulated and all of the impact on the people on the ground. So this evening, I would like for us to begin touching on the reality of Jamaica. So we begin with Gabrielle. Can you tell us a bit about the forces in your country, the geopolitical reality, and all of these scenarios that would have happened in Jamaica during this COVID period?
Great, thank you. I starting off with the COVID-19 impact. First, we reacted quite well. I think everyone was impressed with the way how the government took quick actions with when COVID-19 hit, and we decided to close schools and decided to put in place this social distancing. There are just basically a lot of measures in place. There were shutdowns of churches, schools, and bars, and other non-essential businesses, and so the government reacted quite well. Well, currently there's a little bit of a shift. There's suddenly become a little less faith in the government now, because ever since the government decided to open up the borders, there have been some reactions, even though most people understand that there is a need for opening the borders because tourism is one of our biggest foreign exchange and provides many jobs for Jamaicans. The reaction was because the testings were going to be very relaxed, and Jamaicans just didn't have faith that after all the hard work that we did, all the sacrifices, the job loss that came with COVID-19, the huge economic and personal impact that COVID-19 came, the relaxed way of testing tourists, and it seemed like we were regressing. And also with the different job loss, we have an increase in sexual violence and gender-based violence and domestic violence that came with the impact of COVID-19. So a lot of women especially would be impacted by COVID-19. And recently there's some lacking in the healthcare sector, which brought to a problem that already existed, but COVID-19 made it much worse. So there were about over 100 doctors that had recently been laid off, and even though hospitals are understaffed, there has been laid off of doctors, and people just don't understand why, because we're in COVID-19. It's obviously a healthcare crisis. So we need more doctors. They already have been understaffed, overworked, and it just brought on all the issues that we had and made it much worse. There's also increase of police brutality because of the curfew measures that were in place. So there was some increase with the police brutality, and it's made worse because there are SOEs in place, states of operations, that really shouldn't be happening right now. So there are more increase in communities that are seen volatile, that are deemed volatile, and who lack access to proper lawyers and defenses just to protect themselves against police brutality and the entire justice system. So even the justice system is just completely lacking right now in this time.
I
There
understand
are,
that I understand that there was a gentleman that was shot during the SOE as a means to try and control the public. Can you talk to me in terms of how that has been enforced? Has there been loss of life?
there has been loss of life, and it was more than one gentleman that has been shot. There there have been several reports, so I can't say which one specifically you're referring to. There is one person who has been shot because he was walking away from the police. The police told him to run. So it was basically a threat. They were basically, according to the reports, threatening him. So they told him to run, and because he ran, they shot him. It's just a lot of. There have been a lot. There's the Susan Bogle case where a disabled old woman was been had died because of alleged police brutality and because of the state of emergency and in I believe August town. So there are more than one reports of people being shot and people being killed by the police.
So, in addition to the police repression and the reintroduction of tourism in Jamaica, there have also been discussions with regards to a major hike. I understand that there was a call center that was placed that would have taken it up to 50%. So, how do you view the management between the health sector versus the control of the people? So, do you view them as being more oppressive or more protective? How do you view the governing of the pandemic?
All right, so the governing of the pandemic, it's difficult because with the are you talking specifically about the call center outbreak versus private sector versus public sector handling of the
That's
COVID?
just one example. That's just one example of what would have happened in Jamaica. So I just want to get your insight in terms of how you view their addressing of the issue in itself. How would they have treated those people in
Right.
governing?
So like the private sectors, there have been recommendations, but there's so much the government can do because private a lot of the resources that we own are private based. So we don't actually own anything, and the government can only make recommendations and they can't really force the hand, unfortunately, of the private sectors, which are some of them are call centers and tourism sectors. And because of that, the that particular outbreak in that St. Catherine call center, it despite complaints on the mayor in that St. Catherine and people in parliament and governments have been making complaints, but there was just so much that the government can do because it wasn't a government owned facility. So because of that, the most of our outbreaks came from that center. So after that, they decided to take it a bit more seriously. But even though it still wasn't properly done because we don't have enough resources. So they were saying that people in the call center, though, probably like a little less than 1,000, still had to come back and do the testing at the call center because there wasn't like proper records of where these people live, so the government couldn't like track them properly. So they had to be, even though that there's an outbreak from there, they still had to be taking public transportation to drive to that facility so that they can be tested. And that obviously has a huge impact of infecting the entire public because of that. So it wasn't done properly because we don't, Jamaican government doesn't own much of our facilities that Jamaican people work at.
Okay, well, that's very interesting. And thank you so much, Gabrielle, for sharing that reality with us. So now I'm going to bring it closer to home. And I would like to welcome Angelo Hart from the Movement for Social Justice to speak on the reality of Trinidad and Tobago. Our geopolitical reality and the different forces that have been competing in our country. How has the COVID pandemic been affecting us as a people? Angelo? One second.
Hello?
Yes, and Angelo is with us. So, Angelo, can you now speak to the reality of the
pandemic? Yes, right. So, as the COVID virus continued to spread throughout the world, it didn't take long before it became basically a political football here in Trinidad. The government was able to contain the virus successfully by following conventional protocols. But in terms of being able to provide social needs for people who are affected, there was a lot left to be desired. Meanwhile, the opposition party has taken a stance similar to Washington as demanding that the government reopen the economy completely. A majority of those people who tested positive for COVID were locals who brought the virus with them as they left North America and Europe. They were quickly quarantined while a lockdown of the country was declared. Only services that were deemed essential were allowed to be open. The result of this was that thousands of people lost their jobs, and a lot of people had difficulties paying rent or being able to even afford food. There were safety nets in place to deal with these things, like a salary relief grant and a rent assistance grant, but the process is extremely slow and bureaucratic, and as it stands, thousands of people are still waiting to collect their grants, even though the lockdown restrictions are beginning to be lifted. Right now, many businesses have been able to reopen with limited opening hours, while the number of people allowed to gather in public has increased from 5 to 25 persons. However, in spite of the reopening of businesses, a lot of people are still unemployed and are still awaiting compensation. As I mentioned before, the opposition party has repeatedly called for the economy to reopen. Although that party has its roots in the labor movement, they have shifted further right, and basically they have become a de facto right-wing Indian nationalist party. The situation in Venezuela has further complicated the political scene. Our Prime Minister, Dr. Keith Rowley's recognition of Nicolas Maduro has brought warnings from Washington. The opposing UNC party has openly recognized Juan Guaido as the legitimate president of Venezuela and has aligned itself with Washington concerning the matter. Their stance was made abundantly clear when an opposition MP wrote a so-called whistleblowing letter to the US ambassador, letting him know that the government had defied sanctions against Venezuela. This defiance came in the act of selling a shipment of fuel to a company in Aruba, who in turn sold fuel to PDVSA. The MP in question then went on to call for sanctions to be placed on Trinidad for its refusal to comply with the imperialist sanctions. The letter was obviously met with a lot of contention, the opposition supporters, who make up almost half of the population, voiced their support for the party's position, with many of them praising Donald Trump. And I think it's fair to say that right wing nationalism seems to be on the rise here in TNT as well. Black Lives Matter presented a new dimension to the struggle. The murder of George Floyd at the hands of the Minnesota Police Department sent outrage rippling through the Americas. After a week of protests were organized outside the U.S. Embassy in Port of Spain, America warned Trinidad yet again that it will sanction any company that does business with Venezuela. But while those initial protests outside the embassy involved mostly academics and members of the petit bourgeois, things took a much more serious turn when members of the local police gunned down 3 unarmed men. The police claimed that they were fired upon by the men, but surveillance footage revealed that the men had surrendered to the police and had their hands up when they were shot. The frustration that had been building since the shutdown was now at a climax, and Port of Spain erupted into protests. Now, this entire situation with COVID, I think it has, or it should have, forced us to look at the question of economic diversification in a different way. And I mentioned specifically economic diversification because it is something that we only bring up as a knee-jerk reaction when discussing climate change. But 70%, or a little over 70% of our national workforce belongs to the retail service industry. So we're talking about restaurants, clothing boutiques, fast food outlets, and stuff like that. Most of these people they basically lost their jobs during COVID. And those who worked in these services that were deemed as essential were, of course, overworked and underpaid. So I think this is a chance for us as a country to re-examine the question of economic diversification. We need to recognize it as something that could liberate workers from the menial jobs that they are subjected to, all of those low-skilled minimum wage jobs that can't really provide for people. This is a chance for us to reevaluate what it really means to have an economy built on the backs of workers. And we have been doing our part in the emissary, that is, as we are contesting elections next month. We have been trying to raise the public awareness with regards to workers' rights and labor reform, which is one of the platforms we are campaigning on for the elections next month.
Okay. Well, that was very interesting. There's so many dimensions that came into that. So I just thought that it was very interesting, all the different elements that had to do with the geopolitical reality, and also in terms of the people on the ground and their protests and how it would have impacted in terms of how the pandemic would have developed. So now I want to go to Suriname, because I know that in terms of their neighboring countries, that too had a great impact with regards to the pandemic in Suriname in itself, as well as the elections, which would, of course, a catalyst. So, Claudette, can I now bring you on board to speak to how the pandemic reality would have developed in your country?
Well, thank you, everybody. Good afternoon. Suriname now, we are facing indeed a high levels of people infected. And we're now like 800 and something, 840, I think, people infected. I didn't watch the meter today. But I can see right away that 524 or something are recovered. And what's the happiest news that we have is that the people that were working in the gold mine, iron gold, they now are almost everybody is recovered. There are still 3 who are in quarantine, but the rest, all the workers are recovered. And that was a very good news for us, because we were talking about 80 something workers in the field in Brokopondo area. That's one of our interior. And for now, what we see, we had indeed a very difficult situation, because today our new president and vice president were inaugurated, and because of COVID, they took a lot of measures, and those measures that they took explained had all to do with the COVID. So instead of a whole parade of the our military and our police force, they tried to eliminate it to a 30 minutes parade. That was a good thing too, thank God. And we must say that even those leaders who are now the president and the vice president were infected by the COVID. So the measures, of course, today were very, very, very strict measures, very how you call it? They took the measures so that they know that nobody gets infected today, and I hope so too. I praise God that that didn't happen. And if we look at the economical situation, then we can see the same as you, as Jamaica and as Trinidad saying also, is that we have lots of job losses. What we have is that now the government 2 weeks ago declared that they're gonna open up everything except for the public transportation and except for the um, I think it was the schools and the schools. So only the sixth graders, those are the the classes that where the students are supposed to be having their exams. Those are the only classes that are right now operating. There are no buses running. So what we have is that the majority of the low class workers are still at home because of public transportation. The workers that now in their workforces now, they and the unions, those who have a union, those are together with the employers, made some COVID COVID measures, sorry, and to try to make the work optimum. What we see is that the new government right now is trying to wait a minute. The new government now in place is going to work and uh, try to make other measures, and we are looking forward to see what those measures are. For now, our borders are still locked down. The only problem that we have in Suriname, as I already mentioned, is that in the south of Suriname, next to the Brazilian border, we have a problem with the Brazilians coming over. It's still happening. What we see also is that from France Guyana, there are some illegal uh, French people coming over also. So the government's trying together with the gendarme of the French border to make sure that our borders there are safe. From my neighbor Guyana, Halim, I can say that we don't have so much problem with Guyana because the South Drain is locked, and the South Drain was one of our um, important routes to go to Guyana, but that is locked right now, and there's a very high surveillance of the police there. What we still heard is that our national carrier will be flying one of these days through Guyana to Miami. So I don't know if there will be a case of opening there. But the main concern right now is the south border, and that is the border with Brazil. That I can say. For now, everything is back a little bit to normal. Lots of workplaces are open, especially those who have a union in place. The small businesses, those are closed yet. They are still closed because of the fact, as Trinidad said, there is a problem, of course, with some of the employers. They cannot make ends meet, so people have to go home. They have to send the people home. Even they try to make a 50-50 work assessment, but that didn't work. So lots of workers are at home. We have lots of help from our diaspora in Holland. They sent, they had an, how you call it, they collect money for the people, and they send packages, they send medicine. There even came some sorry for the children in the background. There even came some medical staffs from the Netherlands to help us out, and we're trying to see what will happen in these few days. And what the new government has in place if it goes under COVID measures. I think that's for now. If I miss
Right.
anything, you tell me.
Well, I just thought it was interesting that I remember you mentioning at some point that the situation with COVID was relatively stable, but the elections in itself was a catalyst for a spike. Can you elaborate a little bit more on that?
Yes, because of the elections, a lot of French Surinamese and the French Guyana came over to with their vote, and that's where the pandemic got a bit higher. But then we had a 2 week lockdown, and because of the lockdown, they could place everybody where the clusters are, and they have a pretty few right now about the main clusters, and the main clusters come from the French Guyana into Suriname and from Brazil in the gold fields into town. So those are the major clusters, and that's why we see also that our gold field, mine field, the workers were there in quarantine for 2 weeks, some of them for 3 weeks also, because of the epidemic that was in the gold mine itself. Nearly 82 workers were infected.
Wow. And I think
Yeah,
it's very important to highlight that Brazil has a very interesting stance with regards to the pandemic. Under
yes,
Bolsonaro, who ironically has COVID now. I don't know if ironically should be the word or,
yeah,
as
because
a
he said it was
result
a flu.
should be the word. He too is now infected. And the fact
Yes,
that you all are directly on the border of Brazil, it
yes,
heightens the probability of Suriname being impacted. So Guyana is also right alongside Brazil. So
Brazil. Yeah.
Kelly, the reality of Guyana at this point, I know there's so much happening in Guyana. Can you enlighten us in terms of how governance has been operating there and the reality of the pandemic, as well as being right next to Brazil, which I believe is second in the Americas, if I'm not mistaken, or possibly with regards to the COVID-19 pandemic?
Good evening to each and every one of you. As you know, Guyana
Evening.
is the land of many waters, also the land of many election results. And as such, I think the COVID-19 gave us a break here because lots of persons flouting the COVID-19. Because if you really had it here, there would be numbers of deaths here in Guyana. As you have mentioned, that our neighbor Brazil, they have been the second highest number of cases in the world, and is the border within Region 8. And we don't have much resources to put things in place in terms of cross border. And to date, we have 313 persons have been tested positive. And the most recent deaths is that of a 74-year-old person who died on Sunday on the 12th. That make our COVID-19, 18 COVID-19 deaths. And further, according to the Ministry of Public Health, there is 139 cases, active cases in isolation. That is in various facilities across Guyana. 10 persons here. We have 10 persons in institutional quarantine. The COVID-19 is currently hosting 5 patients, the COVID-19 ICU. As of Wednesday, the 15th of July, there were 3,418 tests conducted with 3,105 negative results. To continue practicing social distance,
Halim, are you still with us? Okay, I think we're having some technical difficulties there with Halim. So in the interim, I just wanted to say that we have this geopolitical reality where COVID-19 was not just our reality,
To the
but
Ministry of Health.
our neighbors' treatment of it and the reality next door impacted all of us. So particularly we heard of the Brazilian border for Suriname, and we're hearing of it with Guyana. And I just want us to reflect on that a little bit and think of how the government would use the pandemic and how they would have addressed the people, because we know this has been an election year for many of us, right? So I think that it's important that we delve a little into that. But Khalif is back, so I will let him continue.
As I said before, there are limited resources which we have here in Guyana. And as such, although the government is saying, or the task force who is in place to put certain measures in place, the people of Guyana, they're saying, like, one of the area which I would mention, like Region 1, they put a lockdown on Region 1, but the Tushal for that area is saying that they don't have that problem there in that region or in that district. And they're saying that the government is implementing those measures in terms of lockdown to make their lives as a matter of hardship for them. So presently now, they're saying they don't have that. And the two shows for those areas, those hinterland areas, they're saying that they are not allowing any government official to go into their villages, because what they're doing is not just to them. They're just saying that they have COVID-19 there, and they don't have any cases like that. But in a country where we have like approximately 800,000 persons, and they're stretched straight across Guyana, there's not much. If the government in place or the task force in place want to do something, it's very hard for them to do it, because you're dealing with the border from my friend here, Suriname, going all the way to Brazil, and then we have a next neighbor here, Venezuela, and we have a very poor. So the government have been put in place, whereas public transport, 50% of those persons who are traveling with public transportation, right? The essential business only allowed to open from 6 in the morning until 5 in the evening. But what have been saving us in our economy here in Guyana is because the government have been paying all the public service servants, the public servants, meaning that the teachers and all who work in for government office, and they are getting their full salary. So the small amount of persons who will be working in private sector, they also have been receiving some amount of money from their job, but not everyone is doing it. Like my staff, which I have here, the staff at about 25, what we are doing, the 5% of their salary. So if you were to look in place,
We seem to be having some technical issues with Halim again. And I just want to encourage the audience to ask your questions. We would
And
love
I just
to
wanted to
engage.
know what you was going to
I
say.
see that Chile is with us. Chile is with us. Thank you for being here, and feel free to engage with the panel and ask any questions you may have about the political processes in the Caribbean.
Yes.
Halil,
Yes.
are you back?
Yes. Yes. I'm having some problem with the internet. That's what happened for
We
the
really
past.
want to hear what you have to say.
Yes. Yes. So
Great.
yes, I'm getting good. So the essential business will be opening from 6 to 5 in the evening. And presently now, they have been putting things in place, whereas we have a plasma treatment. And that was approved by the PAHO, which is, and the World Health Organization. And they have been using that, and that's been commenced since April. And they have been using that plasma treatment on patients, and we have been gotten good results from that. And since the National Blood Transfusion Service has been collecting that plasma from recovered patients, the only authorized health institution to conduct that plasma transfusion, that is the Georgetown Hospital, we are doing great so far. But as I said before, that not much have been put in place for governmental help for the poor and the needy person, the very grassroots person, I must say, because if someone need help, they have to go online. And for someone who is 75 years old, need help, how that person would know that they have to go online besides someone informing them? And I am part of the Region 3 task force, the COVID-19 task force, and I've been recommending to them that we don't need to use this thing online. What we need to do is to use community leaders. And those leaders gonna help to find the rightful person in the area who really need the help. Someone online would just go online and say they need help, and they would get help. And the second thing also, I was advised them, and I saw that they implement that, is to put a station where the point where we have other regions coming in. So this region, region 3, is the main region here in Guyana, where all the other regions pass through here. The mining area and everything, they have to pass through here. And I saw that they start to build something there where they would have tests, anyone coming from region 1, region 2, all those other regions, and from those islands, and the mining air district who have to pass through here, they will stop at a point and check their temperature. And if they find that their temperature is beyond what is required, then they will send them to the hospital from there. And also, I've been telling them also that on a daily basis in our river transportation, the very speedboat which we used to go to Georgetown, to put something there. And I saw that they start to implement that in checking people's temperature. And I've also request that people coming from Georgetown via the boats, the river transportation, should also sanitize before leaving the boat and also going into the boats. We as private citizens, I'm also the president of the Region 3 Chamber of Commerce, and all the other private organizations, we are trying our best to help because the resource is not there with the government. And I hope that the people of Guyana take this, that COVID-19 is real. And not just that, they don't adhere to the people in Guyana here. If COVID-19 really hit us, we'll have hundreds of deaths. If you to look outside, you'll find that every 100 people pass, every 100 person pass the road, you may have like 2 or 3 persons have the mask on. And this comes from, whereas when the election have started, this came because they had a lot of lies behind the COVID-19. According to the election, how it goes, that's how the figure raised up, or how it goes down. I don't know if you want me to go on to any election now or just stick on COVID-19 for a few more minutes.
By all means, Halim, you go ahead and express how the COVID-19 was used as a political tool, because we know the context of Guyana is very particular. We know that, I believe, for the past few months, maybe 3 months or more, there's been a lot of tension in Guyana. So leadership plays a big role in terms of the managing of the pandemic. So the fact that there's been this political element is very relevant. So by all means, Halim, go on.
Yes, so I was saying that the COVID-19, because of the political situation here, when there's an announcement that we have 313 person test positive, and it's on the news or special program, everyone is saying that this is not so. Just a fraction of people would believe in it and try to take all the necessary precaution. We from the private sector, we have offered the region and other areas too that we can put sinks with water in place. So no one should not leave a boat which goes to other region, should not get into that boat besides they wash their hands, sanitize their hands, put those things in place. And I put that in place and I request them to put that in place, and we would have helped financially. And that has been done. But if you do look at the hospitals, someone would go to the hospital and with high fever and so on. There's not much has been put in the other regions of the hospital, which I like, say for instance, let us deal with a hospital a few miles away from here, Lenore Hospital. If someone go with a high temperature and they test that person, the very first thing what they will do, they will send that person home and advise them to use Panadol or something. They will not transfer that person because of the risks which they have in terms that they make, if it's COVID-19, the risk is that they will put themselves at risk and their family at risk. So the best thing what they do to avoid that now, instead of taking that patient to the hospital, the other regional hospital, they will send that patient. And one example I can use, whereas the doctor called me, I'm well known to most of the medical personnel here, and they said that must be careful that there is COVID-19 around. So I said, why? They said last night, this is like last month I'm talking about, that there's a patient came in here with all the symptoms with the COVID-19. And they did an x-ray and their lungs was almost blocked. And because there is no system put in place, what they have decided is to send home that patient and tell him to go get a test in Georgetown Hospital. At that time, only Georgetown Hospital was doing that test, no private hospital. And then the very next day when I send it on to our group, they request the administration for the hospital to find out where this patient live and everything. Surprisingly, that the very next morning, there's not, because they was only dealing with emergency patients. So they would only have 1 or 2 emergency for the night. Surprisingly, the next morning, the administrator for the hospital said that there is no patient like that exists, meaning that they hide away the records and everything. So if they're gonna go that way, and this was during when the heat of the election. So presently now we don't know that if we have that 313 person who was tested positive, or we have double that amount. But God has been smiling upon us here with his mercy, because he knows that the amount of problems we have in with election. I would only put it that way. Because if it's for real, then we really have a big problem here if the amount of person getting it, and not necessarily with the symptoms. And you have known also that because Brazil is next door, they are border crossing. And they're not coming out where people with other areas where people wouldn't be speaking Spanish or Portuguese. They will live around the border area. And I don't think that there is enough being put in place, but things have been put in place to make sure that they get into power back, and not in terms of what is affecting the people, in terms of some of them poverty, not having a job.
Yeah, but poverty has been a recurrent trend across the board. And a lot of the measures that have been put in place didn't necessarily meet demand on the ground and those persons in the grassroots communities. So in Jamaica in particular, some of the measures that were put in place, would you say that communities, the low-end communities, were actually able to access it? Would you say that, for example, social distancing was a reality in low-end communities? Can you give us some insights on that, Gabriel?
For lower end communities, social distancing wasn't really possible because in, for example, St. Catherine, which is the highest resident population, the buildings aren't equipped for social distancing. It's extremely hot. A lot of them are made out of zinc, and the material is just not suitable for you to be socially distancing. And there are many people living in one small area. So it's very impossible for people to be socially distanced. And again, with the police brutality, you have people going outside because they want relief from the heat, they want space. And again, the police have been harassing them. And it's particularly with the lower end communities because we can see that the police doesn't treat the higher end communities the same. They will be on parties in boats, not doing social distancing at all, and they aren't faced with any police brutality or anything like that. And the reality is, a lot of us don't own cars. The for public transportation will be in taxis. There are 4 people in a row. Sometimes there are 2 people in a seat in the front where there's only supposed to be 1. And that's the only way that you can go from whatever essential services, either work or shopping. And so you can only take those public transportation. So social distancing, as much as it's being promoted, it's not practical. Even though people are trying, it's still not practical. Even now, I think it's a lot more relaxed. People are making a lot more efforts wearing masks and so, but we see now that even the police officers aren't wearing masks sometimes. And even though they are saying that, a lot of businesses are saying you have to come in with your mask and they'll give you hand sanitizer. Some of them will test your temperatures, but a lot of private businesses aren't doing that. It's more optional for them than the public services. In some supermarkets, they are doing all of that. They're doing social distancing. They make marks from where people can stand. They restrict the amount of people that can enter the buildings. Although when during the restrictions, you have many people lining up outside, and again, social distancing is just not taking place there. And yeah, the relaxed mask wearing, not many people are not doing that.
And I understand that the testing is optional for the tourists that come inside, even though
Yes.
your fresh cases were imported, yes?
Yes, the testing is optional, and even for tourists, they were like, before the opening up the borders to tourists, they were a bit stricter when it came to local residents coming in, and we kept out local residents for residents in living in the we completely closed our borders, but now we're seeing that it's now optional for tourists. So a lot of people are angry because we kept our own people outside for so long, and you're releasing all these people, but making testing optional. And a lot of our tourists come from countries that are not handling the COVID epidemic well. A lot of them are from the US, UK, Canada, and they're not handling it well at all. And for residents coming in, that's also been relaxed. The residents are supposed to quarantine for 14 days. However, they're going to be quarantined with family because there's just no other option available. So that can't work because your family is going to be out, but you're going to be in and you're going to be in contact with your family. So it's just not realistic at all.
Well, that is very interesting. So that is one reality there. And with regards to the Trinidad and Tobago reality, Trinidad and Tobago has been lauded with regards to the management of the COVID-19 pandemic. And now we are entering elections. I'm sure it's a point that is going to be put to the fore in Trinidad and Tobago for elections. But some of the measures that were put in place, did it really impact the people on the ground? Angelo, can you tell us a little bit more in terms of how was there a disconnect? Did these people were they actually able to access the relief that was provided to them? Angelo?
Yes, there was definitely a disconnect, not just in terms of the grant. The grant was just one aspect of it. As I understand, thousands of people are still waiting for the grant. There were over 30,000 people who applied, and that was, I believe, it was in March when the grants were announced, but it wasn't until May, I believe, late in May, that they actually started paying out the grants. But yeah, as I said, the grants were just one issue of it. There was this recovery committee that the prime minister had put together, and the committee was comprised mostly of people from the 1%, people who worked for the banks and those kinds of financial institutions. So there were very few, if any at all, representatives from grassroots movements or grassroots communities.
Right. So the reality was disconnected in Trinidad and Tobago as well. And we know that that was a reality in Guyana. Claudette, would you say that in Suriname, in the relief programs that they would have had, there's so many people that would have lost jobs. So those people on the lower end, how would they have survived? What access did they really have in terms of the pandemic and measures of relief?
Okay, the former government had a COVID-19 health plan, like a fund, and the people who lost their job during the COVID-19 pandemic lockdown, especially, had to register, and they will get a 1,500 Surinamese dollars for the COVID period. They even get some food packages, as we call them, just to help them to during this period of time. For now, I told you they make sure that the COVID-19 measures are now a bit easier to say, because now we have a lockdown period from 10 in the evening till 5 in the morning. And we see that the people in Suriname are really doing their best to stay safe. But what I forgot to mention is that 2 weeks ago, the COVID team announced that there are 10 persons who went to get tested. They were tested positive. And what happened is, just like Guyana, those 10 persons were registered on an address. And when the first aid the team went to the address, nobody was living there. So right now, we got a new phase of those 10 persons missing in action. Nobody knows who they are. The people asked during the press conferences from, give us the name of the persons. Who are those 10 persons? Maybe when somebody gets in contact with them, we can find them. The government haven't reacted to that. The COVID team haven't reacted to all of that. They put in some. I forgot the shortness of that thing. People lost in action, something like that. 10, and we're still seeing that. So until now, I don't know why they don't want to tell us who those persons are and where they were located. So there are 10 people wandering around, and so we're afraid that they can affect other people. But that's why people right now in town are a bit afraid and a bit concerned, and they put on their face masks. They have their hand sanitizing water. Some stores have their social distances, and I can say pretty much that until now, the people itself in the city in Paramaribo are very careful. The people on the interior side, most in the villages, because of lack of communication, lack of internet, those people aren't aware really what's going on. And that's where when people from the south come in, it's in the interior they come, and in the villages. Two villages, indigenous villages, were locked down for 2 weeks because the Brazilians came in and they nested there because they couldn't get into town. The only way to government town is by airplane and by boat, and that would take days, so they weren't up for that. And the government had to send in food for the villages and medicine. And for now, that is what we're dealing with. And the most concerned right now are the 10 people walking around, because we don't know if they are here in the country, if they are went through the French Guyana. We don't know that.
Right. Well, that is very interesting. And Halim, we have a few minutes left. I'd just like you to touch in terms of how the reality has been for those people, because we see the disproportionate access, and I know that that has been a reality in Guyana. So can you just put a few points together in terms of closing and how you think it was managed?
First of all, let me say that to my friend, sorry, not friend here, that I hope is the $1,500 which you're giving wasn't for the election. Just kidding with that. Right? Also, Guyana need to do that. Just spread something out there and say there's 10 persons who have COVID-19 escape, and we don't know where they are in Guyana. So in this way, they will start to take the COVID-19 serious, and they will start to put on masks, a Suriname thing, and they will stay at home for those guidelines which we have for the COVID-19.
Excuse me, Kali. So you're saying me that those 10%, because that's something that strike me too. Why all of a sudden 10% are affected, and you don't want to say where and when? That's a bit suspicious, you know. Because
yes, so I
and then and you should, if you make a little measurement or a little how you call it, a little 1-on-1, then you would see some affection coming up because we have 840 affected. But those who came out on the 840 were the workers that they counted on the interior and the gold mine. So I ask myself, is it true or not?
That's a good system to put in place. 10 persons on the loose, and they have the COVID-19. To be careful, wear your mask. Everybody will put on a mask. In terms of we have that time for just a few minutes for election to address that.
Sure, but I'm going to ask you to try and summarize as best as you can.
Yes. As you know that Guyana, let me try to summarize this. As you know that the last one of the countries which finally, Brazil, our neighbor, also joined scores of government of other countries to endorse the conclusion of the CARICOM electoral observation mission regarding the figures of the smoothness of the recounts. Likewise, Brazil added to the statement of CARICOM a grouping of 20 countries, whereas 15 member states and 5 associate members. The OS is comprised of 35 independent countries. The European Union, 27 countries, and the Commonwealth, 54 countries. The United States, the United Kingdom, the United Kingdom, Canada, if they're saying that we must use the recount base, and if you add all these countries together, just a few person here is saying that the recount is not valid. But I was part of that observation team for the recounts. And I don't know if you could see this here. This is a certified copy. And this here, a certified copy of the recount under the command of the very man who bringing all these wrong figures, Lowenfield. In the GCOM staff under the commands of Lowenfield, who certify these results for each electoral district, which when the recount was concluded. And on this certified here, it has which party has the amount of votes, and it's been signed by the GCOM, the electoral body here. And this was held by Lowenfield, Mr. Lowenfield. But with this, seeing that we don't have much time, we're trying to compile it. The very first figure which was done, and that wasn't tabulated, which is Region 4, District 4, there was a guy returning office named Mingo. He had added the original SOP, which is the total amount of voters, 456. Mingo added for the government, the coalition government, 19,000 to that figure, which would bring them to 476. That is in the 5th of March. The 13th of March, he was asked for the tabulation again, and he added 18,000 votes again, add to its original SOP, which brings that vote to 475,000. Now, in the recount, what we have, when we finish recount, it mounts up to 460,352 votes, which is 3,000 votes difference. Lowenfield on his first report, when it was asked by the chairperson there for the commissioners there for GCOM, his first report on the 13th of June, he got, and he's the one who certified at that recount the amount of votes. And it's on paper where no one can doubt that. This is for certified copy. I have all the copies for all the district. And he said that on this same document, the certified copy, it have how much is reject votes, how much is spoiled votes. And he disenfranchised 275,000 persons, 275,092 votes. And he said that the total valid vote now is 185,000. Given the coalition governments, 125,010 votes, which was 67.5%. And the PPP, the opposition, who gained in the recounts 233,000 votes, he gave them 56,627. That is 30% of that vote he have given them. And going back to the second, I said I will try to summarize this quickly. The second report, which is on the 23rd of June, Lowenfield subtracted 115,000 votes, valid votes from that. And his counts is going 344,000 from that. Whereas our recounts figures show, so he showed totally disregard of the. And also the last one, on the 11th, the third one, that's the third, on the 11th of July. That amount of valid votes, 1,000, 118 votes, whereas he found, while going to that office, 14,766 votes, where those people never voted. Those people never on the list. And so he added that to the figure to bring 475,000, which is more than what the recount states. He was the sort.
Yes, we know the situation in Guyana is particularly tense at this point, with a lot of confusion around the actual count of votes. And I understand that it's come to some measure of stability at this point. Halim, are you with us? Okay, I think we're having some technical difficulties there. But that certainly would have added to the tense reality. And unfortunately, in Guyana, it's been a number of months that they've existed without an official government. So we definitely want to shed light on that matter. And thank all of you for being here with us and for participating in the panel. I think it's really important that we're able to hear the realities throughout the Caribbean and to know what is happening and how the people are actually affected by all the measures that are being implemented. So at this stage, I would like to thank all of you panelists. Thank you for sharing your reality and sharing that with us. And I continue to look on with regards to what's happening in our Caribbean and our Americas. Have a good evening. Thank you.
Thank you.
Yes, it's been signed by the staff of GCOM, which comes under command